Hello, this is Greg Ehlers. I am the host of Einstein's disease, and we're closing out today's wonderful show with Dr. Jawad Arshad, CEO of Wow Health. We've been discussing today one of the rudimentary problems, really root cause of the challenges in healthcare, and that's the lack of education or the challenge to find answers when you have a healthcare problem. With some of the solutions that we came through with Dr. Arshad were programs that are offered by Wow Health, the company for which he founded. And we've really been fortunate to get some really great answers and some wonderful ideas about how to look at healthcare going forward, because everything else in the world is changing. And it seems that what Dr. Arshad has done here is he's found a way to move to the consumer, move to you, versus where everybody else is sitting back saying, we'll just send them another bill. I find your company and your strategy very exciting and extremely interested. I'd like to spend this last segment with you, Doctor, to learn a little bit more about how you started the company. When you started this company, did you have the expectations, I'm just going to start this, it's going to work, people are going to love it, it sounds good, it's not expensive, and then all of a sudden said, wow, it's a little harder than this. So maybe you can just kind of get to there, and then we'll follow it up with a few more questions and give our viewers a little more insight into the entrepreneur element of starting a business and the challenges that you've had to face and overcome.
Yeah, thanks, Greg. Yeah, so as you alluded to, I am a physician by training, right? I'm an ER physician. I have had really a fortunate career path where I've worked for a large health system, both clinically and administratively in Southeast Michigan. I have since then left corporate medicine, so to speak, and started my own clinic, and I became an employer in that process, and also started to come face to face with my clients, with my patients, recognizing that healthcare truly is blind leading the blind, right? Patients have no idea what any episode of care is going to cost, and neither do we as providers. I may tell you you should get an MRI, but I have no idea what your cost would be and if you are actually going to get it done. So I think so those are some of the things, right, that led to the creation of the idea of, hey, what if we look at routine outpatient care, carve that out, let's put that on the side and allow our members access holistically again, right? So not only telehealth, but also for in-person care, take them to a local clinic if the need be. You're going to pay for it, but telehealth is free. So creating that incentive and creating that opportunity for our members to get care meaningfully. But if they need to go see someone in person, either out of choice or out of necessity, then we're going to be able to get them there. But then not only doctor's visits, right? Thinking about, hey, what about medications and labs and imaging and dental and procedures? And so all of these things, right, we were able to build a complete continuum of healthcare, and there are great partners of ours out there who provide these services in a direct pay manner, which again ends up costing almost always less out of pocket than a traditional insurance encounter may. We then started thinking about, what about the other 5 to 7% of the events where you end up in the hospital, and started looking at some alternative arrangements. We alluded to one, health share or medical cost sharing, in our last segment. So I think now putting these two together, it feels like that we have been able to solve the healthcare problem. Well, then you come again, the curse of the incumbent, right? Where you have, for example, a front desk person, and yes, the practice contracted with us. The practice said, of course, we will see your members, perhaps for $100 a visit, okay? And just send them whenever they have an appointment. Well, the conversation took place with the manager, and the new hire at front desk has no idea about this special arrangement that the practice has come into. So you call and you say, hey, I'm going to come and see Dr. So-and-so. And the front desk says, what's your insurance? He said, well, I don't have insurance. I am a self-pay through Wow Health. And instead of honestly asking, because I don't know if that person doesn't want to come across as being ill-informed to their new employer or what, right? They say, oh, if you don't have insurance, we can't see you, right? And this is where you either have to advocate for yourself, right? And you say,
Yeah,
no, let me talk to the manager, right? Or more people than not just kind of give up, right?
yeah,
And they'll say, "Oh, they're not going to see me, I guess." And so I think so. It's that issue, right? Again, one of you started the show with one of education, right? We're having to educate our members how to be able to get care, but then also we need the rest of the medical healthcare dispensing community to be educated as well, that, it's okay to think about getting paid for a service outside of having to submit a claim to the insurance carrier.
absolutely. And,
Yeah.
and I think that, when you frame it that way, we've been in an environment for a while with higher interest rates, higher levels of inflation, which have necessitated higher wages. There isn't a doctor's office out there. You're a doctor. You'd much rather get your money today than wait 60 or 90 days or debate it with the health insurance company.
Mhm.
So that whole education process on the other side is, we have a whole nother episode with that one at some point, Jawad. Um, so spend a few minutes and what about the internal aspects? I mean, you started out with a baseline and said, this is what I'd like to build. And you started to build it, you had a baseline, then there were some corrective action measures. Share with us one of those corrective action measures that was probably a little bit more humbling than you might have thought.
Yeah, I always joke that entrepreneurship is a bipolar experience, right? There are up days and down days. You feel like you've gotten the solution and it's an up day, and then you are humbled by an issue that comes up that really sort of came out of left field, right? So we have situations that come up. One of the issues, Greg, that is that healthcare is a very episodic event, right? Most people don't actually even think about needing healthcare more than maybe a couple of times a year, right? Especially I'm younger, I'm not going to the doctor on a regular basis. I may think about healthcare once a year when I get the sniffles. How do we stay in front of your mind, right? So that when you are feeling ill, you are going to know that this is my resource. This is where I can go and get that care, right, that I need. So I think just staying engaged with people who even know about us is a challenge because of the nature of healthcare, right? So we've had to come up with some ideas about how to add value on an ongoing basis from a wellness standpoint for our members. And then, of course, as I mentioned, you talk to the medical practices and they're getting killed, right? Because of the amount of money they're losing on insurance claims and paperwork and just the sort of the back office minutia. And yet even their own employees are sort of, standing against uh, that practice from becoming, or at least, having some of their money come to them in a different model where they're getting paid
Absolutely.
now versus later.
Um, Absolutely. So Jawad, as we bring this to a close, and we see, Wow Health is obviously an accessible website for everybody to take a look at. Why don't you tell us a little bit about our viewers today are going to go on and they're on their smartphone, tired of listening to me, and they're going, this Wow Health, this is pretty neat. So if they sign up today, how long does it take to get Wow Health? And to our viewers out there, if you put in hashtag Greg, you get 10% off. So that's for your first month for Wow Health. Tell us a little bit about how long it takes, Jawad. What's the process for the folks out there?
Yeah, it's really simple, Greg. I mean, we address the needs for individuals. You're 1099, independent contractor, maybe someone who is not getting healthcare benefits. but then also for employers, right? So it really is regardless of how you are going to come, and you can come to our website, and search for a membership. And again, as any membership, we have different tiers, right? Someone who is young, fairly healthy, a basic membership, $30 a month, $1 a day may be sufficient. They're going to have access to a doctor, not necessarily the same doctor, through a virtual urgent care at zero cost. And if they need to go to a clinic for an in-person appointment or visit, right, that would be done through the platform as well at $100 a visit. Now, then on the other hand, you can build that up, and you can go all the way to comprehensive, where it becomes a complete replacement, effectively, of a traditional insurance product at, as you know, 50-60% less cost than what you may be paying in the form of a premium alone.
That's fantastic. So www.wowhealth.com. To our viewers out there, visit the site, understand what it's about. Jawad, it's been a pleasure to have you on the show today. I really appreciate your entrepreneurial spirit and what you're trying to do for so many people out there. And I applaud you for taking on a endeavor that really will do a lot for a lot of people if we can, and hopefully we did some of it today with respect to the education process in how things work. So
No, correct. I just want to point out one thing at closing, right? Because for us, healthcare is very personal. We have purposely made our website www.mywowhealth.
My bad. Sorry, Jawad.
MYWOW.
I got you. mywowhealth.com. Error on my part. Good way to close out with a correction from a doctor. Listen, everybody, thank you very much for tuning into our show today. We look forward to seeing you next week. It's Greg Ehlers from Einstein's disease. Good night.